This is a video for AP Statistics Chapter 5, Designing Experiments, and this is the second section of Chapter 5. And just an important thing to remember is you always want to use randomization whenever possible, whenever you're writing something for an answer or just like thinking about designing an experiment. And so let's get started with what is the difference between an observational study and an experiment? Well, in an observational study, you observe and you measure data, but in an experiment, you actually impose a treatment on subjects and you observe the results. So the difference is in this right here is experiments have treatments. And so another thing that to keep in mind with experiments is the placebo effect. So this is when a patient is favorable to any treatment, even placebo. So for example, if you're doing a cancer research experiment and you have two groups, group 1 and group 2. Let's say group 1 is given chemotherapy and group 2 is given nothing. Studies show that even if a drug doesn't always work, sometimes there is a placebo effect that patients think they're getting better, so therefore they get better. But when a group is given nothing, they tend to stay the same. So it's important that if you have two groups and one group is going to be given a drug, you give the second group that would have gotten nothing some sort of other drug, like a sugar pill is usually used. And so there's different elements of experiments. One is control. And this is used to reduce the effect of working variables. So for control, usually what you would do is you would only use, one treatment versus another treatment. And you would try to keep all the other variables the same in order to reduce the effects of working variables. For example, let's say you're doing the difference between different exercises. Let's say running versus swimming. You would want to try to lose weight. You try to keep the diet of both treatment groups the same, because a working variable could be different foods that people eat could influence the response variable, which is weight loss. And then another thing to keep in mind with experiments is randomization. So this means that whenever possible, you're going to want to leave things up to random chance to reduce bias. So this means that, when you're conducting an experiment, you're going to want to use a random number generator to choose subjects, or you might want to just try to leave things up to random chance and not other factors. And then also replication. And replication is when you're going to want to increase your number of trials or subjects in order to reduce variation. So for example, we have an experiment and it's on people and we have 3 people. That's going to have a lot more variation than if we have an experiment with, say, 200 people. Because these three people right here could respond to the treatment very differently than larger the population. So 200 people is going to be more accurate. And so also something to keep in mind is blindness. And blindness is usually used to reduce variation and kind of reduce working variables. And so in a blind experiment, the patients are unaware of which treatment they're receiving. So this can go back to with placebos and sugar pills. A patient can be given an actual drug that's trying to be proven that has an effect to reduce cancer growth or try to stop any other disease. So that would be one drug. And then in a blind experiment, the researchers would also give a sugar pill so that patients don't know if they're getting the sugar pill or if they're getting the actual drug. And then also, sometimes experiments will be double blind. And this means that neither the subject nor the observer are aware of which treatment the subject is receiving. And this is commonly used when observers are describing the results and describing the subjects, because sometimes researchers, if they know that one patient is being given something versus the other, maybe they'll do things in the way they act or things they say to make the patient realize which drug they have, or sometimes it'll just screw the results. And then also something to keep in mind is the lack of realism. And this is when you're unable to conduct an experiment because of limits. So for example, sometimes maybe an experiment won't work because the patients will catch on that there's something going on and there is an experiment. Sometimes it's just the conditions of the experiment aren't able to go with the reality of the world. And then also something to keep in mind is a block design. And sometimes when you use a block, it's used to reduce variation, and also the different blocks are going to be put into similar groups. So for example, if there's something in the genetics of people that make people respond differently to drugs, say for a certain cholesterol medication, a man is going to respond differently to a woman, you would block based on gender. Sometimes people of different races will respond differently to drugs based on their genetics, so you could block on race. And sometimes you can even block on age. Really, it's just if you have information that people will respond differently to drugs based on something similar that they have in common, then you want to block based on that just to reduce variation and make your results really good. And so also something is matched pairs, and this is a specialized kind of block design, and this is used to reduce variation even further. So for example, let's say and whenever possible, always use a matched pairs design if you're able to, because it's kind of reduces variation the best, because it's basically you have such minimized other variables. And so let's say, for example, that you're doing an experiment with bicycle tires. For this, you would use a matched pairs design, and how you would do it is that each bike has 2 tires, so you would put one of each tire on each bike. So one bike would have tire 1 and tire 2. And also you could implement randomization into this by saying, well, tire 1 will be on the front for half the bikes, and tire 2 will be on the front for half the bikes, because let's say the tires are different on whether it's on the front end of the bike or the back end of the bike. And when you have this matched pairs for bikes, because both tires are on each bike, you reduce other factors, like let's say if we had both tires on one bike, both of tire 1 on one bike and both of tire 2s on another bike, let's say the person who's riding bike 1 might go bike 20 miles a week, but the person who rides bike 2 could go only 2 miles a week. So this is just matched pairs is really good to use to reduce variation and just make sure that everything's the same and that only the variable you're changing is putting differences in the response variable.